There is a forgotten Korean spice that restores saliva and ends morning dry mouth within minutes of your first bite. And your doctor has never mentioned it. If your medication gives you dry mouth every morning, don't look for a workaround. Look at whether your salivary glands have a second system your medication never reached. Run your tongue across the roof of your mouth right now. If the moisture is not there, if it drags instead of glides, keep watching. Susan did the same thing, got the same result. That is where this starts. Every morning, Susan, 67, woke up with a mouth that felt like she had swallowed sand. The first thing she registered before she was fully awake. Her doctor told her it was her medication, a side effect of the overactive bladder pill. The workarounds: drink more water, chew xylitol gum, try an artificial saliva spray. She tried all three. The gum gave her 30 seconds of relief. The spray left a film she could feel all morning. The water helped for one swallow. Then the dryness came back before she reached the kitchen. What her doctor never explained was why the medication was doing this, and what exactly it was leaving untouched. And what changed things for her had nothing to do with her prescription. What Susan's doctor never mentioned is something Western medicine has no way to teach. Korean households have been waking up a second saliva system every morning for generations. Her mother called it banchan, that wakes the body up. Susan had a jar of it sitting untouched in her refrigerator. Don't look at the saliva problem. Look at what your medications are actually blocking and what they are not. Here is where it gets interesting. Here is what most people are never told. The medications causing your dry mouth do one thing. They block the nerve signal that tells your salivary glands to work. And that nerve signal is only one of at least 2 ways your glands make saliva. Your salivary glands have a second ignition system your medications haven't touched. It is built directly into the gland tissue itself, and the spice that activates it has been on Korean breakfast tables for generations. And here is where it gets more specific than that. Most people with medication-related dry mouth believe they are stuck. Susan did too, for 18 months. They believe the only real answer is to stop the medication. That means convincing a doctor to change a prescription that is keeping them well, or managing the symptom forever with gum and sprays. What they don't know: there is a receptor in human salivary gland tissue that produces saliva through a pathway your medications never reached. And what the research showed when I looked at it closely stopped me. If you stay on gum and sprays without addressing the second system, the consequences build. Chronic dry mouth accelerates dental decay. It progressively impairs taste and swallowing. And it disrupts sleep through nighttime dryness that resets the same problem every morning. That is where this goes if the second receptor system stays untouched. If your tongue dragged across the roof of your mouth just now, that is not a prediction. That is your gland output, measured right now. I'm Dr. Sarah Kim, and in 2010, researchers at the University of Hong Kong looked directly at human salivary gland tissue and found it. A heat-sensitive receptor expressed directly in the gland tissue itself. Researchers call it TRPV1. In plain language, they looked at actual human tissue, not a mouse, not a cell line, and found the receptor is there. That finding appeared in peer-reviewed literature and has not been disputed. And this is where it stopped being theoretical. Xylitol gum and artificial saliva work on the surface. They add moisture temporarily, or they trigger the same nerve signal your medications are blocking anyway. They cannot reach the second system. What happened next is not what anyone expected. Capsaicin does something none of those approaches can. It binds directly to that heat-sensitive receptor in the gland tissue. It triggers the gland to release saliva through pathways that don't require the nerve signal your medications are suppressing. In plain language, your medications block the nerve signal that normally tells the gland to work. Capsaicin walks past that blocked signal entirely and speaks directly to the gland through a different door. The jar sitting in Susan's refrigerator went directly to that door. Your doctor has likely never mentioned this. Not because it is being withheld, because Korean red pepper cannot be patented. Without pharmaceutical investment, it never entered Western treatment guidelines. Capsaicin works through two pathways. One depends partly on the nerve signal your medications block, and yes, that part is reduced. The second runs through the heat-sensitive receptor directly. In the human study at the Karolinska Institute, researchers blocked the main saliva nerve signal, then applied capsaicin. In plain language, saliva production dropped, but it did not stop. That residual response is the second ignition system, the part your medications haven't touched. And here is where the Korean tradition turns out to have been right all along. What I kept noticing in my Korean immigrant patients was a pattern I could not explain with standard clinical training. They were managing the same diagnoses on the same medications, and their dry mouth complaints were consistently milder. When I traced what they had in common, it kept coming back to the same morning foods. Kimchi on the breakfast plate, gochujang stirred into rice, gochugaru in the eggs. I'm Dr. Sarah Kim, and the cardiologists hadn't prescribed it. Their grandmothers had. I started noticing a pattern. Patients on the type of medication that blocks the nerve signal to your salivary glands, the type most likely to cause dry mouth. Patients from Korean immigrant families on those same prescriptions were reporting significantly less dry mouth. Susan's case was one of the clearest. Same medication, same dosage, same age bracket, and a full Korean breakfast every morning. When I traced what they were doing differently at breakfast, the answer was always capsaicin, kimchi, gochujang, gochugaru, eaten every morning as a matter of routine. That put capsaicin on my radar for this specific mechanism. Not research papers, but a clinical pattern I couldn't explain any other way. Here's what I found when I traced it. Think of your salivary glands as a building with two electrical systems. Your medications throw a breaker switch on the main system, the nerve signal-driven one. The gland goes dim, your mouth goes dry. But the building has a backup generator. It is a heat-sensitive receptor expressed directly in the salivary gland tissue itself. Researchers call it TRPV1. Not connected to the main nerve signal, not affected by the breaker your medications through. When capsaicin arrives from your breakfast, kimchi, gochujang, gochugaru, it binds to that receptor directly inside the gland, and the backup generator switches on. And this is the part that surprised me most when I first read the trial data. What happens when that receptor fires? Two things your medications cannot stop. Fluid starts moving between the gland cells, and the cells that physically squeeze saliva out start firing. In plain language, the gland starts pushing saliva out through a pathway your medications were never designed to block. Susan felt it the first morning she added kimchi. The drag across the roof of her mouth was gone before she finished eating. And here is where the human evidence gets specific. In 1986, researchers at the Karolinska Institute applied capsaicin to the tongues of human volunteers. They measured saliva production from the main salivary glands and the gland in front of the ear. In plain language, capsaicin triggered measurable saliva production in real humans. Then, they blocked the main saliva nerve signal with that same type of drug. Then, they applied capsaicin again. Saliva production dropped, but it did not stop. That residual response is the heat-sensitive receptor at work, operating through a pathway that drug had not reached. That result confirms both things. Part of capsaicin's saliva effect depends on the nerve signal your medications block, and yes, that part is weaker. But a second part survived. That is the second ignition system, the one Susan's morning kimchi had been engaging all along. And then, the University of Hong Kong did something that changed how I think about this entirely. In 2010, researchers at the University of Hong Kong examined actual human salivary gland tissue and confirmed the heat-sensitive receptor is there. In plain language, they looked at actual human salivary gland tissue, not a mouse, not a cell line, and found the receptor that capsaicin activates. The same team applied capsaicin cream to the skin over the gland in human subjects and measured increased saliva production. One transparency note: that experiment used cream applied to the skin, not dietary capsaicin. The route is different, though the receptor is the same. Whether the dietary dose matches the cream dose has not been studied in a published trial. That is the receptor Susan's morning kimchi was reaching. What we have: a receptor confirmed in actual human salivary gland tissue, a saliva response confirmed in human volunteers, and a mechanism that explains why capsaicin still works even when your medications are blocking the main signal. No clinical trial testing dietary capsaicin in dry mouth patients exists. That gap is real, and you deserve to know it. And what the researchers found next changed how I think about this entirely. A 2016 review in the journal Molecules looked at all the available human and animal research. The key finding: the effect was considerably larger in people with reduced saliva than in people without it. What that means for you, and what it meant for Susan, the people who needed it most, had the biggest response. Now, I want to show you exactly what to do, because the protocol is simpler than you think, and the timing is everything. The protocol is not a supplement. It is not a capsaicin cream. It is the Korean morning dietary practice that has been delivering capsaicin to those gland tissue receptors every day for generations. It is exactly what Susan's mother had been sending her. The goal is consistent daily capsaicin through Korean foods, eaten with your morning meal, not on an empty stomach. First, kimchi, 2 to 4 tablespoons of baechu kimchi or kakakdugi, alongside your breakfast. This is what Susan started with. Both use gochugaru and deliver capsaicin directly to your tongue and oral tissue from the first bite. Available at H-Mart, Korean supermarkets, and increasingly at mainstream grocery chains. Second, gochujang, 1 teaspoon stirred into broth or rice. The fermented paste releases capsaicin gradually, the milder option for sensitive stomachs. Third, gochugaru, a 1/4 teaspoon in eggs or morning soup, more concentrated than gochujang. Use this if you tolerate spice well. Timing: always with food, never on an empty stomach. Eating first reduces the risk of stomach irritation. Susan always ate a few bites of rice first. Take all 3? No. Choose 1 per morning. Kimchi is the easiest starting point. Gochujang is milder. Gochugaru is most concentrated. Here is what most people notice. And when. What to expect. Within minutes of your first bite, the heat-sensitive receptor in your gland tissue fires. Susan noticed it the first morning, before she finished her breakfast. Most people notice increased moisture within 2 to 5 minutes. It is not a cure. The medication is still doing what it does. But you have activated a pathway the medication was never designed to silence. In weeks 1 and 2, most people notice their mouth feels less dry at breakfast. Consistent morning exposure is what maintains it. The review found measurable differences in everyday saliva production with consistent exposure by weeks 8 to 12. The commitment is to a breakfast habit, not a pill. Before we go further, nothing in this video is medical advice. I'm sharing peer-reviewed research so you can have an informed conversation with your own physician. If you're on medication or managing a diagnosis, please loop in your doctor before making any changes to your routine. Before you start, read these. If you have reflux, frequent heartburn, or any diagnosed condition of your esophagus, do not add capsaicin without clearance from your physician. Capsaicin relaxes the valve between your esophagus and stomach, which can significantly worsen reflux. This is the most important warning for this age group. Reflux is common, and adding capsaicin without addressing it can cause real harm. Susan checked her medication list before starting. You should check this one first. Blood pressure drugs, lisinopril, ramipril, enalapril, can cause a dry cough as a side effect. If you have that cough, adding capsaicin can make it worse. Capsaicin affects the same nerve pathway that drives that cough. This is not a reason to avoid capsaicin permanently. It is a reason to speak with your prescribing physician first. If you have IBS, Crohn's disease, or ulcerative colitis, dietary capsaicin may aggravate bowel symptoms. Consult your gastroenterologist before starting. If you are on warfarin or a blood-thinning medication, capsaicin can mildly affect how blood clots, but not at food portion amounts. Worth mentioning to your prescribing physician. Susan's list was clear on this one. If you are pregnant or breastfeeding, capsaicin in food at normal portions is generally considered safe. High-dose capsaicin supplements have not been studied in pregnancy. Avoid the supplement form. If you have an active peptic ulcer or gastritis, consult your physician before adding. The morning practice is straightforward, but there are 4 specific ways people run it wrong, and one of them is the reason most people quit before the habit forms. Mistake 1. Taking capsaicin on an empty stomach. Capsaicin on an empty stomach increases the risk of stomach irritation, and if you have reflux, the discomfort makes people quit before the habit forms, and it is entirely avoidable. The fix: always eat something first. A few bites of rice, toast, or eggs first protects the stomach and makes the experience comfortable for most people. This was the first thing I told Susan before she started. That one is easy to fix. The next mistake is less obvious, and it is the one that makes the entire mechanism fail before it starts. Mistake 2. Using capsaicin supplements or hot sauce instead of Korean foods. Most supplement capsules are coated to pass through the stomach whole. The capsaicin arrives in the intestine. It never touches your mouth or the receptors in your salivary glands. Generic hot sauces vary enormously in capsaicin content. The fix: use kimchi, gochujang, or gochugaru, where capsaicin contacts the tongue and oral tissue directly from the first bite. That contact is the mechanism. This next part took me by surprise when I first started tracking patients who were doing this consistently. Mistake 3. Skipping the protocol on days your mouth feels better. After 1 or 2 weeks, the temptation is to treat it as a remedy for bad days, not a daily habit. That receptor responds to each morning's dose. Skip mornings, and you lose the benefit. Susan made exactly this mistake in week 2. Her mouth felt better, so she skipped the kimchi 3 days in a row. By day 4, the dryness was back. She went back to daily, and it didn't happen again. The fix: treat this like your morning medication. It belongs on the breakfast plate every day. That one is a consistency fix. The last mistake is the most important one. And if you are on a blood pressure medication, I need you to read this carefully. Mistake 4. Ignoring the blood pressure drug and reflux warnings. If you take a blood pressure drug, lisinopril is the most common, and have a dry cough. Adding capsaicin can make it worse. Capsaicin and blood pressure drugs affect the same nerve pathway. If you have reflux, capsaicin can worsen your symptoms. Neither is a permanent reason to avoid this protocol. Both are reasons to speak with your physician first. Check your medication list before you start. Before I close, let me tell you what happened to Susan. Susan was 67 when she started waking up every morning with a mouth that felt like she had swallowed sand. Her doctor told her it was her medication, a side effect of the pill she took for her overactive bladder. The prescription was working. The dry mouth was the price. Within 2 weeks, she told me her mouth felt human again by the time she finished breakfast. The kimchi was from the jar her mother had sent from Seoul, sitting in her refrigerator untouched. Not perfect, the medication was still doing what it does. But the second ignition system was on. She called it what her mother had always called the morning banchan spread. Food that wakes the body up. Your dry mouth medications block the main nerve signal, but your salivary glands have a second receptor system. built directly into the gland tissue that those medications do not block. Researchers at the Karolinska Institute showed that even after suppressing the main nerve signal, capsaicin still produced measurable saliva. Researchers at the University of Hong Kong confirmed that receptor in actual human salivary gland tissue. The second ignition system is confirmed in real human tissue and survives the medications that cause dry mouth. Next week, pine bark extract, pycnogenol, and what it does to artery wall flexibility overnight through a mechanism standard cardiovascular prescriptions cannot reach. If you want to be here for that one, subscribe now so it lands in your feed the moment it publishes. If this was useful, share it with someone managing dry mouth who was told the only answer is gum and water.